personalized. This is Consumer's Doctor on the behalf of Foremost Organization. We have been talking quite a bit on different health-related topics. Let's talk about the government programs. Today's topic is government programs. What are the government? We have 200 million Americans on private insurance. There are roughly around 70 to 75 million on Medicare. And you have about 15% on Medicaid. And let's talk about Medicare. Medicare is a government subsidized program for all the seniors folks. What the Medicare from Department of HHS funds these programs, and the funds are given to the private insurance companies to take care of the so-called Medicare Advantage. By signing up on Medicare Advantage, basically, you're giving up on your Medicare, as you all know. So you will not have Medicare. So private insurance companies like Aetna, Blue Cross, Blue Shield, and United Healthcare, they will take over. They will be receiving the premiums from the Department of HHS, Health and Human Services. They will be receiving the funds, and they'll be taking care of your healthcare needs. But majority of the Americans want to stay on Medicare. This is the thing. A lot of people would like to see the Medicare. And what they do is, instead of just staying on Medicare, they will get a supplemental policies. Supplemental normally takes care of the 20% portion of the payment. So this Medicare is running out of money. Basically, baby boomers are overwhelming the Medicare system, folks. The coverage is so inadequate. Coverage is so inadequate. They may have to purchase expensive Medicare supplemental policies. That's one of the reasons why a lot of these senior folks are signing up on Medicare Advantage. So these private insurers, once they take the funds from the Medicare, they basically tell you what to do. So you lose the control on your health care. They tell you which doctor to go to. They can tell you which medical group you can go and which hospital you have to. So you lose your freedom. You cannot choose your doctor. You cannot choose your hospital. You cannot choose your lab, and even your co-pays and deductibles. And sometimes you need approvals, because these private insurers require approvals prior to any surgery. So there is a cost involved in it. And that's one of the reasons why even the Medicare, so-called Medicare Advantage by the private insurers, the costs keep going up and up and up. So that is a government subsidized program, and it is becoming expensive, especially people who stay on the Medicare supplemental. What is the next? What is the second government program? It's called Medicaid. Medicaid is government insurance program for the poor. Yes, for the poor. It's draining federal and state budgets, and it is fraught with fraud. It is a fraud. Payments to care providers is so low, that many doctors do not accept Medicaid payments. They will not accept Medicaid payments. As a matter of fact, I have received, when I billed the Medicaid for 10 patients I have seen, they had the audacity to send me a 1 cent check. Can you? This is how the Medicaid. It is Medicaid is. There's no doubt. There's a lot of fraud involved. There's an abuse and fraud. You may have a Medicaid insurance card, but access to healthcare is limited, folks. Access to care. Medicaid is limited. What is the third government program? It's a veterans health. Veterans health, so-called TRICARE. That system has long waiting lines and inadequate care. Maybe it has changed somewhat, but it is always there has been a long waits to see a doctor when you're on TRICARE, and that also has child health insurance program called CHIP. TRICARE and CHIP. TRICARE is military health, and CHIP is for the children health insurance program. They all need reform and added flexibilities to improve the coverage and the patient care. The government subsidized programs require, there is no doubt they need a healthcare reform. Solutions to the government control programs are difficult because there are lobbying interest and resistance from special interest constituents. Yes, special interest constituents. Too often, the comprehensive solutions include these programs, folks. They include these programs. These are the comprehensive solutions. That is usually a kiss of death for any proposal, any proposal. Such reforms are typically decried as hurting the poor. If you try to do something, oh, you're hurting the poor. Throwing the grandmother over the cliff. If you try to make some changes into the government program, that's what you get. Oh, you're hurting the poor. And you're throwing the grandmother off the cliff, over the cliff. Let's set aside these government programs. Let's focus on these 200 million Americans getting health insurance in the private market. Let's look into that briefly, because we have talked about government programs are hard to reform because, as you know, because of their interested parties, and they cannot make any changes. Let's see how the private insurance market works for the 200 million Americans. Let's explore that in contrast to the government subsidized program. I want to give a contrast to the government subsidized program. As you all know, the Lyndon Johnson in 1960s introduced the Medicare and Medicaid. That's how the government program started. But this private insurance have been in the vogue for quite some time, after the First World War, from 1930s onwards. So I have a separate segment how the Medicare, Blue Cross, Blue Shield started. So it's an interesting topic to listen. So in the private market, there are large employer-sponsored plans, over 300 employees. They belong to a large employer group. They need reform. There's no doubt they need reform. Most of them are full-time employees. The reforms they are needed are price transparency, because most of these people are self-insured by large employer groups. They're all self-insured. They are much better than the employer subsidized plans are much better. And the government subsidized programs can compete compared to the employer subsidized. They need more transparency. That's what we need. We need some reforms among the larger employer groups. And they also need to have more, they also need to have they need more of a quality, self-funded group. We can improve on the quality measures, how the large employer groups. So those are the issues needed in the larger employer group section. 70 million folks are in the larger employer groups. So they're all self-insured, and some of them have, right now as we see it, some of them have health savings accounts, personal care accounts, health reimbursement accounts. So only thing they need to be reformed on price transparency and quality measures on that group. What is the next group, which is very important, is a smaller employer sponsored plans. Smaller employer sponsored plans, no one seems to focus on the smaller, because this is where most of the people, employers, are not able to provide insurance. Right now, we have been fighting on the minimum wage issue. Till that minimum wage issue is resolved, employers are not able to support. Some employers, they do. So the issues in the smaller employer groups, the reforms are needed. Issues are guaranteed issue for pre-existing guaranteed issue of the health coverage, and pre-existing conditions, they need to be covered. For smaller, I'm talking about the smaller employer groups. And you need to eliminate the single risk pool, folks. This is where the premiums are so high. It's because of the single risk pool by the insurers. They're not segmenting the risk into well category, at-risk category, chronic illness, and catastrophic. They need to segment it. The insurers are not segmenting, because most of the smaller employers have to depend on the insurers. These insurers are resisting to make changes in the risk pool. So we need to eliminate the single risk pool aspect of it. And that will lower the premiums. That will make the insurance premiums affordable. So smaller employers can provide insurance for their employees. If we can tackle that, the premiums will go down by 20%, folks. So we need to focus on eliminating the risk pool. The third category are the individual policies. Individual policies. They need reforms. Again, you need to have a coverage for a guaranteed coverage, and you need a coverage for the pre-existing conditions, and you need a choice and affordability. Affordability of premium, affordability of healthcare. And there has to be, in this particular segment, individual policy should have impaired health support group, and again, eliminate the single risk pool. This is even in the individual policies. If you eliminate the single risk pool, and segment into 4 segments like well category, at risk, chronic illness, and catastrophic categories, you will lower the premiums. And not only that, you will, under the Health Review Authority, so-called as a public-private partnership, we can implement all these measures under the Health Review Authority for individual policies. With individual policies under the Health Review Authority, which is a public-private partnership, you will have a guaranteed issue coverage for the pre-existing, and you will have a choice, and you will also have affordable premiums along with impaired health support plans. Number 4, what are the fourth category? Uninsured. This is where the problem has been. Uninsured. They need reforms. People who voluntarily do not buy insurance, there needs to be consequences. If people don't buy insurance, individual or people are uninsured, some fair number of people don't buy because, if you're a 30-year-old, I don't need health insurance. That's what you can't do that. You have to have it. Even irrespective of the age group, you have to have insurance for all ages. And if they don't get the insurance, there are consequences, folks. Consequences are you lose your deductions from federal and state filings. As a result, people will get the health insurance. If you lose the deductions for individual or a family, then you're paying more in taxes. As a result, they will be obligated to get individual insurance. But there are reforms needed in this. Uninsured. You need to have, among the uninsured, one is for economic reasons, people who can't pay the premium. For the economic reasons, if they don't have the health insurance, this is where Health Review Authorities gives a guaranteed coverage for these, and also they'll get federal and state funds. And most of these funds coming from people not having insurance, they will be collecting more revenue from people losing their so-called deductions. So they'll collect more in taxes. And also, even in this group, you have to have a guaranteed issue, pre-existing conditions, and you have to have a choice, affordability, and you have to, people who are impaired, there has to be an impaired health support plan. This is where our focus should be. People are insured and they're impaired for health reasons. This is where this segment is only 2 to 3%, folks. We can do it. We can tackle this group. It's easy to tackle 2 to 3% than the entire population. So when you focus on this impaired health support plans under the Health Review Authority, they will get the certificate of guaranteed coverage, and they will have incentives and rewards even in this group. So that way it will lower the premium for the rest of the folks once you have segmentation. Insurers have to segment all the risks. They cannot just have a single risk for everyone. Once you segment it, the impaired health support plans under the Health Review Authority will be able to provide care for all Americans, folks, all Americans. Thank you for listening. If you do like this channel, subscribe, share, and hit that bell. We will see you in the next episode. Goodbye.